New research shows breast cancer survivors face a number of health risks after therapy, including an increased risk of cardiovascular problems. Dr. Andrew Brenner, a medical oncologist at St. David's Medical Center and Texas Oncology, is joining us to discuss the findings. Tell us a little bit about this study.
So this was a case control study. So basically what they did is they took around 90, almost 100 breast cancer survivors, and they compared them to approximately 200 non-cancer patients. And these were all postmenopausal women, so they already went through menopause. They're all over the age of 45. And they looked at a number of different outcomes. They looked at the risk of developing clot or plaques along the carotid arteries. They looked at diabetes, waist circumference, a number of other factors. And they found that a number of these were increased. Matter of fact, women were twice as likely to have plaque develop along their carotid arteries. They were twice as likely to develop diabetes, increased risk of having lipids, triglycerides in their blood. And so all of this suggests that women who have breast cancer are at increased risk of potentially cardiovascular outcomes that need to be looked at after we treat women.
Is any of this linked to chemotherapy, or is it lifestyle?
It's a little bit of both. We do know that women gain weight after chemotherapy, and some of that is the medications that we give, including steroids. So women can gain weight strictly from the chemotherapy. Certain chemotherapies can damage the heart. And then when we do radiation to the breast, we have to be very careful to keep the radiation away from the arteries that supply the heart.
So let's talk about things that women can do. If you are a breast cancer survivor, you should be on alert. What are some things you can do to make sure your heart is safe?
Yeah, so the most important thing that we also always counsel women on when they're going through chemotherapy is to watch their diet and to maintain physical activity. So by keeping active and by watching what you eat, you can keep the weight down and reduce the risk of developing these increased lipids and weight gain and this metabolic syndrome. And then on top of that, we have studies that are ongoing through cooperative groups like the Southwest Oncology Group. We're actually giving women cardioprotective medicines, a group of medicines called beta blockers, and we're looking to see if we can prevent decline in heart function with these medications.
Yeah. You know, eating right and staying active, it sounds easy, but it can be really hard to do, especially if you're going through chemo.
Right.
But little steps would help, right?
You're right. And, you know, a lot of these women, a lot of the weight gain has occurred well before, over a number of years. So changing lifestyle can be difficult, but little steps at a time can make a difference in the long term.
And it's never too late to get started, right? If you're just hearing this today, you can start today.
No, absolutely not. Every little step you take can make a big difference in the long term.
Dr. Brenner, we thank you so much for being with us this morning.
Pleasure.
We appreciate it. And if you guys missed any of that, don't worry. We'll have this interview right on KV.com after the newscast. We'll be right back.